Medi Talks. Every talk, a health tip.
You know that moment when you feel a bit off, maybe a headache creeping in, perhaps slight fever, those muscle aches that just, ache? You probably think, oh, it's just a cold, right? Something that'll be gone in a day or two.
Sure, happens all the time.
But what if those very ordinary symptoms could actually be a sign of something? Well, something you really should know about.
That's where we're heading today.
Today, we're doing a deep dive into leptospirosis. It might not be a household name, but it definitely warrants some attention.
Absolutely. Leptospirosis is caused by these incredibly tiny bacteria, and the interesting part is where they hang out.
Okay.
Mostly in the urine of animals. And we're talking quite a range here, rats, obviously, but also cattle, pigs, goats.
Wow, okay.
And yeah, sometimes even dogs and cats, plus various wild animals. It's a broader spectrum of carriers than most people think.
Right, so tiny bacteria, animal urine. So if we encounter this contaminated water or mud, how do the bacteria physically get inside us?
Well, they're quite opportunistic. They can slip in through any breaks in your skin, even tiny cuts or scrapes you might not even realize you have. But they can also enter through mucous membranes. So your eyes, your nose, even your mouth. Think about drinking untreated water, maybe from a stream or it's contaminated by animal runoff. That's one way. A really common scenario involves people working in muddy fields, like rice paddy farmers, for instance, or just walking through floodwaters after heavy rain. Also people who clean drains or canals dealing with stagnant water. And even things that seem less risky, like, say, bathing or maybe kids playing in what looks like dirty rainwater or floodwater runoff.
Okay.
Basically, any situation where potentially contaminated mud or water touches your skin, especially broken skin.
So building on that, who are the folks facing the highest risk? It sounds like some jobs really stand out.
Absolutely. Farmers, as we mentioned, particularly those in wet paddy fields, that's high risk.
Makes sense.
Anyone working closely with animals, like vets or farmhands. Sewage workers, canal cleaners, people regularly exposed to those environments.
Right.
Interestingly, even gem mine workers can be at higher risk because of the constantly wet, muddy conditions. And as we've said, anyone caught up in floods or dealing with widespread mud needs to be cautious too.
Okay, so we get how it spreads and who's most likely exposed. Let's talk symptoms. What actually happens if someone gets it? You said earlier it can look like a normal fever.
Yeah, and that's a really critical point. The initial symptoms often look so much like other common things, they're easy to dismiss.
Like the flu, maybe?
Exactly. Usually somewhere between, say, 5 days and 2 weeks after exposure, you might get a fever, often with chills. A really bad headache is common. Muscle aches, joint pain, sometimes red eyes like bloodshot. People often feel incredibly tired. And you might get some stomach issues too, vomiting, diarrhea, stomach pain.
So a whole mix of fairly general symptoms.
Very general. And the tricky part is, sometimes these initial symptoms are quite mild, feel just like a regular bug, and they might even seem to get better on their own for a little while.
Ah, okay. Which could make someone think they're over it.
Exactly. And that delay in seeking help can be really problematic if the disease progresses.
What are the warning signs that it's escalating?
Yes, if it progresses, the signs become much more alarming. A major one is jaundice. That's when your skin and the whites of your eyes turn yellowish.
Okay, that's noticeable.
Very. Also, a significant drop in how much you're urinating. That points towards kidney issues. Other severe signs can include coughing up blood or finding it difficult to breathe.
So it starts like the flu, potentially, but can really damage your kidneys, your lungs, even your heart. That sounds incredibly serious.
Those severe complications, fortunately, if it's not treated promptly, leptospirosis can be fatal.
So if someone is feeling those early symptoms, the fever, the aches, and they think, hang on, I was walking through that flooded street last week, what is the single most important thing they should do?
Go to the nearest hospital immediately. No delay. Don't wait to see if it gets better. And critically, when you get there, tell the doctor or nurse about your potential exposure. Mention the floodwater or working in the field, or contact with animals.
Why is telling them that's so important?
Because those initial symptoms are so nonspecific, right? Knowing about the potential exposure helps them think, could this be leptospirosis? Much earlier. It guides their diagnosis and testing.
Got it. And once they're at the hospital, if leptospirosis is suspected or confirmed, what does treatment usually involve?
Treatment primarily involves antibiotics. The doctor will prescribe the right ones.
Okay.
And it's absolutely crucial to take the entire course of medication exactly as prescribed, even if you start feeling better partway through. Don't stop early. They'll also likely do blood and urine tests, both to confirm the diagnosis and to check how your organs are doing, how you responded. So follow all the medical advice, go to any follow-up appointments, and basic self-care helps too. Getting plenty of rest, drinking lots of clean water to stay hydrated. That supports your body's recovery. Let's switch gears slightly to prevention, because obviously avoiding it in the first place is ideal.
Always better, yes.
What practical steps can people take to lower their risk?
There are several quite effective things. If your work involves fields, mud, or animals, wear protective gear. Boots are essential. Gloves, too. Create a barrier.
Makes sense.
Try to avoid walking barefoot in muddy areas or floodwaters if you can possibly help it.
Okay.
Remember how it gets in through cuts? Cover any cuts or scrapes you have with waterproof bandages before potential exposure.
Good tip.
Basic hygiene is huge, too. Wash your hands thoroughly with soap and clean water after working outside, handling animals, or dealing with soil.
Right. Yeah, a couple more things. Environmental control helps. Keeping your home and surroundings clean. Managing waste properly to discourage rats, since they're major carriers.
Rodent control, okay.
Yes. And also, for those in really high-risk jobs like farmers, it's worth knowing. Sometimes local health authorities offer preventive antibiotics.
Oh, really? Like taking medicine before you get sick?
Exactly. It
Yeah.
might be something taken just once a week during high-risk seasons. It's not for everyone, but farmers, for example, should definitely ask their local public health inspector or medical officer about it. See if it's available and recommended in their area.
Okay, we've covered a lot of ground. Before we wrap up, any key misunderstandings or final takeaways we really need to hammer home?
Yes, definitely. One really crucial point. Leptospirosis is not typically spread directly from person to person.
Ah, okay. Good to know.
Another key fact, currently there isn't a widely available vaccine for humans.
No vaccine, so prevention is really our main defense.
It really is. And finally, it's worth saying one more time. While it might start mildly, this disease can become very serious, even deadly, if it's not treated quickly. Early treatment is key.
Okay. So let's just recap the essentials then. Leptospirosis, serious disease, bacteria from animal urine, usually spread via contaminated water or mud, starts often like the flu, but can get much worse, affecting vital organs.
That's the core of it.
Key is knowing the risks, using those prevention strategies. Boots, gloves, wound care, hygiene, avoiding dirty water, and crucially, if you feel sick and suspect exposure, get medical help fast.
Absolutely. It's serious, yes, but it is preventable. And it is treatable, especially if caught early.
Yeah.
Those simple precautions make a huge difference.
Yeah.
And just remembering that prompt medical help can literally save lives.